Hi, Facebook. I just wanted to give you an update of what's going on. The last time I spoke or did a video, I was having a lot of problems and issues and going in and out of the hospital. I said I was going to go to the doctor the next day, which I did, and they admitted me to the hospital again. I just got out on Saturday, the day before Easter. And I kind of just wanted to go over things. Let me just start with my numbers. I was 292 when I started my journey. The day of the surgery, I was 288. And today I weighed myself. It's been a month and 3 days. I did my surgery on March the 18th. And today is the 21st. So today I weighed myself in the morning, and I weighed 257. So I started the day of the surgery, I was 288, and I weighed 257 today. So basically I've been throwing up non-stop, foam, spitting up. I started spitting with so much acid in my mouth. Disgusting. Haven't been able to eat. I was in the hospital those days. Since Tuesday. And they didn't let me eat. So I had no food in my stomach, and I felt like I was literally dying. It's been the worst experience in my life. The day before I got released was actually the first day I actually felt okay. No nausea, no barfing, no throwing up, nothing. I felt so much better. I felt 100 times better. So I saw a different doctor, the main doctor, and he gave me different scenarios of what can be happening to my body. They say that when you do the gastric bypass, sometimes they could cut a nerve with your stomach that could affect everything in the muscle. Your stomach is a muscle, so it could affect it being able to process anything or move or break down food. It could cause a lot of issues. Then they say sometimes your body is rejecting the surgery. Your body can actually reject it, and it just takes forever for you to get well. That's why there's different complications. Another thing is just that it's healing, or there's something wrong. So that's what the doctor explained to me. Also stated that I needed a PICC line because I wasn't eating and throwing up. Then I needed to get the nutrients through the PICC line, which is an IV almost they put in your arm, which you can see here, and it goes to your heart. And basically what happens is they give you IV for you to be able to eat and get the nutrients that you're lacking. I was literally at like 0 potassium. I had no potassium whatsoever. My electrolytes were really low. Everything was really messed up. So I ended up I went to Fountain Valley, and I'm from California, so I went to Fountain Valley Hospital the week before I was admitted. I think I told you guys that. They did a scope in the mouth. They just found 2 little ulcers, and were saying that it could be the little ulcers that were affecting me. And I said, I had these ulcers before. I never was sick like this. I never threw up or never was sick. So they said there was nothing, and that I'm just healing. So they took me out of the hospital, and that's when I kept throwing up at the house, and I just couldn't handle it anymore. I literally felt like I was dying. Something was wrong with me. So the doctor said that I did the upper GI. That thing got me so sick because they were forcing me to drink so much of a contrast, and they had to do the x-rays. They took pictures basically of it going to all the lower intestines as well, just to see if there's no sutures, I think it's called, or when it heals, it's not so tight. So it took them a long time to the next morning to keep on taking pictures because it was going so slow through my body. They said, oh no, there's nothing wrong. They didn't even see the ulcers when they did it. So they ended up saying they're going to do the scope again in my mouth. And the doctor, the main doctor, which is where I got my surgery, said that he was going to be in there to watch everything to make sure that they could go lower to see if there's something else going on. So they did the scope lower, and then they found a staple in my stomach. Took it out. I guess the doctor forgot to take it out when he was in there operating. I don't know how that's possible, but there was a staple in my stomach. That night that they took it out literally was the worst night of my life since I've had the surgery. I couldn't stop throwing up. I had no food in my stomach. And there was acid was, I was throwing it up. I had bubbles and blood in it. It was like the worst. And finally I just it's just been stressful for my family, for my husband, for me, because I've been thinking that I'm going to be stuck with this forever. And it's sad because a lot of us that want to do this is because we want to be healthy. Everybody just says, oh, you lost so much weight, that's really good, you're doing good. And it's good, I'm losing weight. I'm happy. Good for that. But I'm not happy losing it like this. It wasn't the point of me losing. Obviously you lose weight, you're in a healthy balance. To me was, I want to be healthy. I want not to have diabetes. I want to have my polycystic ovary syndrome under control. I want my glucose level to go down. I want my fatty liver to get fixed. I want all these different health issues that I'm having. My GERD to go away, and I still need to feel better. And basically what's going on is it's worse now. And then you have all these people and you hear horror stories. And I advise you guys not to hear the horror stories, and I'm not going to say it here because I don't want to scare anybody. Do I feel a lot better? Heck yeah, I feel a lot better. I feel like so much better. I still kind of feel weak. I'm tired. I'm really, really tired. I'm sleepy, but I can't sleep. It's just like this. I walk around, I get winded. I jumped in the shower the other day and I swear I thought I was going to pass out and die because I couldn't breathe. I started wheezing. I don't know if that's ever happened to anybody. It's been very difficult. I met different people who have had issues, and I just pray to God that everything goes good for me. Because right now the way I feel so much better, and I'm hoping it's a positive journey from here because I see so many people that are so happy doing this, and they're great, and they're healthy, and they eat good. I'm not like food, like they know how to cook, and they make like certain recipes, and they're able to consume it and eat enough calories throughout the day. And with this machine that I have, the vitamins and the nutrients it's giving me 1,500 calories a day. And I'm trying to eat, but literally I don't think I'm capable of eating 1,500 calories in a day. There's just no way right now physically I'm going to be able to. I'm trying though. They said I could have smashed potatoes. I tried smashed potatoes. It was so good. I enjoyed it so much because I've been in this whole month, not being able to eat anything, and just having Jello and chicken broth, like literally just liquids. And you get to a point that you're kind of like, come on, you want something. Your brain and your body want to eat something. Just not even has to be fat food. I look at even healthy stuff. I see salads. I'm like, oh my God, I want that salad so bad. Or just you want to eat. You want to be able to eat food. Your body is going through starvation, and you want to eat. So when I ate those, the nurse is helping me because now that I'm back home, I have this IV thing that I have to put on my arm. They have to flush the lines, pick lines. I have 2 lines. There's so much stuff you have to learn. It's like a horrible thing, but this is making me feel so much better. And once I'm able to eat enough and drink enough, then they're going to take it out, and I'm hoping less than a month, and I'm hoping to maintain it. The nurse told me, the best advice I could give you guys of what she told me, because I never even realized, or no one ever really explained to me, but your body right now, when you're healing and you're so fresh out of surgery, you should at least be eating every hour. You know, every hour. Your stomach is the size of an egg, you know, and you're supposed to be eating every hour, I guess, and that will stop the acid from accumulating and for you to be sick and throwing up. So, the doctor, no one explained it to me, and she's been the one, so I literally been forcing myself to eat every hour. Trying to eat every hour. Just a spoonful, like a potato or whatever. I made myself, my husband made me Jamaica. I'm Hispanic, I love Jamaica. It's like a flour, I forgot what they're called in English, but I put it with sweet Splenda. I'm gonna go get the different sugar because I heard it's better. But I've been trying to drink that. The water, I actually do drink the water, but this is actually so good, so I like to drink it more. It's helping me. I'm trying to see what I can do. Basically, my journey is they took out a staple out of my stomach, and they're giving me this nutrition. And since I've had this nutrition and the staple out, I feel a lot better. I don't have the nausea. I get scared that I feel it when I get kind of full. Like, I'm like, oh God, please don't give me the nausea. Easter was the first day I was actually out. I saw my family, tried to stay in close to anybody. Since I've had the surgery, I've been sick, so I haven't got to see anybody or see my nieces or my little cousins or anything. So it was really nice. I just was really tired and I had to come home and put this machine back on. So I don't know how long I'm gonna have this machine. The doctor just basically told me that if I keep throwing up and I'm sick, then basically he's gonna have to go in there and see if there's any issues or problems that were done in the surgery that they can't see. If not, they're gonna reverse it. They're gonna reverse my stomach back and reverse everything, and there's no guarantees that I'll get better. A lot of people who get reversals done and they have their stomach back to normal, they say that they feel really good and they're back to normal. There would be such a waste and so much suffering for it to be like that. So I'm hoping that I'm okay, and I'm hoping this doesn't cause any more complications. And I'm so sorry for everybody who has ever gone through any complications. I will be praying for all of you guys. I've never been sick in my life like this, and this is the first time God really pushed me and tried to humble me, because literally it's the worst experience. Feeling like anything could be wrong, or you're gonna live like this for the rest of your life. Positive notes is I have lost weight. My sugar levels, my blood pressure is so good. It's excellent. Like, everything is really good and excellent. So those are positive things. I'm just waiting to see if I get my period, because I told you guys I have polycystic ovary syndrome, and I had surgery like 2 days later and getting it. I'm cramping, so I'm hoping I get it. It's still normalizing. I don't know if it is. I'm hoping. I haven't taken my thyroid medication since my surgery because I haven't been able to swallow, but they're telling me I need to now. So I'm going to try tomorrow. I just wanted to give an update, kind of go over things with you guys, and so you guys know that everything is good. It's getting better. And recipes, if anybody knows anything really good that has a lot of nutrition in it, that I could probably have a little bit, that I could actually at least get some calories in, enough nutrition for me, then that would be helpful. So thinking about everything, like, there's so much fat food I can eat fat food, and that will give me enough calories, but how's my body gonna react? The point is, you trying to stay away from it. And what if I have oily food? I'm gonna be barfing all night, and sugar. I can't have sugar because then I'll start throwing up or having diarrhea. So it's kind of hard. You have to really learn how to eat healthy and what you can eat. You're learning how to eat again. So I'm gonna go buy some baby food and see. But I'm learning. This is a big learning process and a long journey, and it's been rough. I'm hoping by the end of this month, or I don't know, at least the middle of next month, I'll be without this machine and being good and being able to eat enough and not getting dehydrated and being sick. Because it sucks being in and out the hospital and them poking you like it looks like, you know, if you can see it close. It's all scarred and it looks nasty. And then I got to wear some old clothes that I haven't worn for like ever that fit me again. Some shoes. I didn't even know your feet shrink, but my shoes actually fit me that I never even got to wear. So, that's basically it. Those are positive things and things. If you feel sick and you're going through whatever you need, be persistent and talk to your doctor and make sure you get the help and make sure you have the support, because I know it can be hard without having the support. I have my husband and my parents, and I'm telling you, my mom is like my lioness fighter. She will fight with anybody and protect me from anything. She is investigated, and I think the more she's learned about the surgery, the more she's been freaked out because she's read so much stuff, and I just kind of calm her down. She calms me down, and she makes sure that the doctor paid attention. If it wasn't for her fighting with them, and they probably wouldn't have never even gone back in there and seen that I had a staple in there or did anything. But the doctor's been helpful, and he's been right. The PICC line has helped me. I didn't want to do it because I've heard so many other stories about it, and it made me very sad, but it's helping me. So I'm getting better, and I'm hoping I become even more better. So I've lost the weight, and I'm getting better, and we'll see what happens. If you guys have any questions, inbox me, subscribe, and watch my journey. Like I said, I'm going to be honest with you guys about everything. I'm not going to sugarcoat things, because if you're wanting to do this, I want you to know these are possibilities of things that can happen to you. Everybody's different. My body's reacting to this differently, and it's true, your body goes through a shock. You know, you're so used to, you grow up with a certain system, and this is your body system. If someone comes and changes everything, and for you to feel like okay right away, your body goes through shock. And when we're going through it, we don't really think about it like that. We're just suffering and going through pain. And I'd rather be in pain and be cut up or whatever it is than to have the nausea. The nausea, living with nausea every day and throwing up is like the worst thing for me. So thank God I don't have that right now. I feel way better. And I'm super happy and blessed about it. So subscribe and watch my journey. If you have any questions, let me know. And good luck with everybody. Good luck with your guys' decisions, and good luck with your journey if you're watching this and you guys have done it. If you guys have any advice at all regarding maybe you've gone through this, or maybe recipes, things that I can eat and enjoy them and will help me with some of the calorie intake. Let me know. Okay? Thank you so much, you guys. You guys have a nice day and a happy, I know Easter already passed, but it was yesterday, so happy belated Easter. I hope everybody had a good time and have fun with the family. And keep up the good journey and keep up the diet. Be good. Stick to it. I know it's hard. Okay? Thanks, you guys. Bye-bye.